Hello, Patricia, can you hear me?
Hello, we hear you very well, so let me introduce you. Hi, everyone again. Welcome to Gorgeous Getaways. My name is Patricia, and I'm your destination manager from Mexico. I'm very happy to introduce you to Mr. Luis Villa. He's the Senior Business Developer of Riviera Institute for Plastic Surgery in Cancun, Mexico. And he proudly represents Drs. Alicia Benavides and Naim Maldonado. Riviera Institute is located inside Galenia Hospital, and which is the only one accredited in Cancun for the Joint Commission International, and is also certified as a safe hospital according to the new normal protocols. Luis will give you plenty of information, so I am sure you will decide to go ahead with your cosmetic surgery procedure here, and at the end we will have a Q&A session. So get ready and welcome Luis. Luis, it's a pleasure to have you with us today.
Thank you very much, and it's a pleasure indeed to be with you again and with everyone listening to our conversation. We'll give you a quick guidance of what it represents a day in our services from the moment you arrive to the airport up until the moment you go back home. So we hope to gather this information for you very well, very clean, and if you have any question regarding a specific procedure or a specific part of the service, we can totally go through. So I'm gonna share the screen in order to show you a few pictures of what we do. And let me open this more. So this is our institution, the Riviera Institute. We've been in the service of medical tourism over the last 10 years. Up until the last 4 years has been a very exciting moment for us because we had 2 leading surgeons that we're gonna speak about their background a little bit more. And we also like to say that this is a vacation, so you can escape secretly to have your procedure done and come back to your home and no one knows where did you get your procedure, you know? So this is a day in the life of our institute, and I'd like to play a video for you. So just give me 1 second to play it.
It was uneventful. It went very well and smooth, and as I mentioned before, I had met the anesthesiologist. I'd already met the
American woman, gonna mess your mind. American woman, she gonna mess your mind. American woman, gonna mess your mind. American woman.
So far, so good. I'm very pleased. My reception was fabulous, and the communication has been extremely good. Obviously, I'm jumping into this somewhat blind, but I've been very pleased with everything that's happened thus far.
This paper for the hospital, and that's it.
I just want to make sure, I really want, under here,
Yes.
as much lift
Yes.
and sharpness here as possible.
Yes.
I want this as much without looking false.
But what do you feel with your eyebrows and your eyelids?
I feel like when I'm tired, I have to hold my eyes up to see well. You know what I'm saying?
Mm-hmm.
So I feel like it starts to fall. I don't know, you'd have to tell me.
I think that you don't have much skin here.
It's been really nice, actually, other than the fact that I'm a little nervous about the surgery and just it's out there. It's all been flawless. My level of care from you has been wonderful, and meeting the doctor has gone very smoothly. I feel like the doctor is very intelligent and calm and attentive to my needs. It's all been great.
The surgery was perfect. She is now in the recovery room and everything is okay. The patient just has to come to the hospital, and nurses and all the personnel take the patient. And she was happy and anxious because she decided to get the surgery time ago, and she was very, very happy.
Face brace on me, which is a little strange. It's like having a big hug from a teddy bear for the night. So that was on me, but it was uneventful. It went very well and smooth, and as I mentioned before, I had met the anesthesiologist, I'd already met the doctor, I had no concerns at all. And the pain has been, it's definitely there, but it's manageable, and I'm very pleased with the hotel room, and the nurse staff is excellent, the communication is good. Anytime I want anything, they're here in 2 seconds. I feel like a diva. So I'm happy with the process. I'm fine with the pain. I think the results look good, what I can see of them at this point. I think the doctor was extremely attentive, and I think he really knows his stuff. And I'm looking forward to getting back to the hotel.
Hola, ¿cómo están? Mi nombre es María José Pech, soy enfermera, orgullosamente del Instituto Riviera. Actualmente me encuentro cuidando a una persona, soy paciente del doctor Naín. Se le realizó una bléfaro con una ritidectomía. La acabamos de acompañar al hotel donde se está hospedando, donde yo la voy a cuidar. El poder estar acompañando en una ciudad donde ella no conoce. Le estamos poniendo los hielos en los ojitos porque le hicieron la bléfaro.
Today I'm leaving. I'm tired today, but I just think some of the excitement of the actual process has worn off, and obviously there's a lot of healing. Obviously the results are still happening, but I can tell already, like I can just tell that my skin feels more uplifted. I know I look like a squished pumpkin, but I can still see the difference. It's been just an A+ experience, I have to say. And my friends were like, you're crazy, don't do it. But I have been very pleased. It's been extremely clean, which is what everyone worries about, right? You don't want to go to a foreign country and die of an infection. I have had incredible care. I've had work done before where it was outpatient and I went home, and this is a much higher level of care. I had a nurse every day. The nurse was so lovely, so attentive. She outlined my medicine 100 times, explained it to me, made sure I took it. When I complained about my pain, she called the doctor. She got a different drug, which made it completely tolerable. The hotel, I was concerned because I had 3 hotels to pick from, and I chose the least expensive one. And I was just hoping that wasn't an error in judgment, and it wasn't. The staff was very attentive. The maids were excellent.
Experience of a patient. We are normally having a patient on a daily basis, and my duty here is for you to have the best experience you can with the driver, with the nurses, and everyone. So upon arrival, this is the airport of Cancun, Terminal 3, which is the international terminal. And in order to meet, we have developed like a spot to meet at the Starbucks. So you walk outside the airport. Once you arrive, you walk left all the way back into the main entry, and then there we meet at the Starbucks. This is how it looked like. Actually, it's a pretty airport, and that's the spot that where we are gonna meet. This is the map of Cancun. Everything's really close. This city is very, very close. Actually, from the airport to the hospital, it is a 10 minutes drive. And within every transportation you need here, it's gonna be a 5 minutes drive. So everything's very close, very in the downtown, in the touristic area. So it's very lovely to see around the view and everything. So this is the Galenia Hospital, which is interconnected to the Four Points Hotel. We're gonna check also the accommodations. This is the other hospital that we are working currently, AmeriMed. And like 10 blocks from there, it is our suites, Viento, and the other hospital, Victoria. Currently, it's very important to mention that we are not working with Victoria because of the COVID situation. They are receiving a lot of patients, and we don't want to mix our surgeries, which are elective, with the other patients. So AmeriMed and Galenia are with the outstanding protocols, and that's the reason we are working with them now. And this is the other place, the Salvia Suite, where you can get to see a very beautiful view of the beach. So regarding your accommodation, first we'll talk about the surrounding services of the surgery, and then we'll go through all the way with the surgeons and the medical team. But how to decide a hotel or a suite? It mainly comes to asking if you're traveling alone or with somebody else, and how do you want the service to happen, because some people want to order food to the room or all the stay, and some others want to have different options. So that's why we have these two options. The ultimate comfort is the 4 points, and as you can see, both are interconnected. There's your room, and you just go on the elevator, walk in the hallway, get the elevator from the hospital, and then you get to our office. It's very comfortable there, and the view is very good. It's a Sheraton hotel, so quality is at the top. And this is our latest incorporation into the accommodation services. This is Viento Suites. They are specialized in medical tourism. That's the type of residents that come here. So you will be even able to meet someone else that came to have another type of surgery, or maybe to see the odontologist. So this is a very nice spot to spend the time. And in the inside, we get to have a small living room, the kitchen with everything you need, and your room. And there's even a yard with a pool, so it's amazing. And it's, if you believe it, it's $40 per night. So your stay is gonna be something that you don't have to worry at all. In case you say, okay, I'm comfortable there, but I want to stay some days in front of the beach. You know, I came to Cancun. I want to see this wonderful blue that we can get from the window. So that's why we offer this other hotel, and it's located at the epicenter of the hotel zone. So just go downstairs, you have a 7-Eleven, walk half a mile, and you have a grocery store and a little mall. So everything's really, really comfortable there. You can sit somewhere to see the beach, or if you come with someone else, they can enjoy the beach as well and the pool. And this one, the furniture is not as contemporary as current one. This one has more like a 90s trend, but the quality is very, very good. We do this because we want your stay to be with a very reasonable price, but we want it to be hygienic. We don't want you to get any type of infection, because some patients may want to go to the absolutely cheapest, and we try to make the best deal for you. And we supervise the places. We get in constant touch with the places. There in the Viento, we have a fantastic relationship with Diana. Diana is always there. And if you need something from the grocery store, if you need any type of help in your room, extra towels, extra bed sheets, anything, she's just ready to have them for you. And when it comes now to the hospital choice, as I mentioned, we are currently working with both the Galicia Hospital, that you can see it's a massive top world infrastructure, and spending the night there, it's more an experience like in a hotel of 5 stars, you know. This is a surgery that we have there, and it was a rhinoplasty, and this is both of the doctors working in a team when it comes to a package, like for example, a mommy makeover, or some patients want breast work and face work. So that way, both doctors can work as a team. This reduces the time at the table, and this makes it even faster for recovery. Surgery that would normally take up to 8 hours, we can reduce it to 5 hours, and that makes the body to stress much less, and that way you can have a faster recovery, and with their background, of course, of the results they can achieve for you, which is also very important. This is a very artistic work, in sort of speak, you know, I've always tried to get the doctors to help us to explain more what they do, and it has to be more with the shapes of your body, with your personality, on what is the change that is going to make you be happy for the rest of your life or for the several number of years. This is the other hospital, Amerimed. Both have the exact same accreditation, and as a matter of fact, I believe that Amerimed has even more accreditations. The only difference is that Amerimed is not focused in a luxurious cafe, in a luxurious room. It's like a very, very good hospital. And as you can see, this is another surgery going on. And this is our medical team, in which we have 2 people get in charge of the resources that the surgeons need. We have another 2 nurses that are handing the tools and the equipment to the doctors at the exact point they need it. We have another doctor who is a plastic surgeon that is helping Dr. Nain, and of course the anesthesiologist. So we work like clockwork, and this makes the experience of the surgery like very, very, very amazing, to be honest. I've seen other works, and our doctors are even very, very well taken care of by the hospitals, because we are like very professional, to be honest, because we also always want you to have the best experience in the surgery. So going to the surgeons, Dr. Alicia has been working in plastic surgery over 25 years. She has been interviewed on CNN, and she's like the best surgeon in this side of Mexico. And now she's on her mid-60s, so she's looking for the next surgeon that is gonna take care up to her level of our patients. Our team, this is on the left of Dr. Alicia, Dr. Luis Guzman, our anesthesiologist that has been with Dr. Alicia for 20 years as well here in Cancun. In the left, that's Maria Jose that you could see on the video. She's always gonna be taking care of you on the post after the surgery. So anything you need, she's gonna change your garments or anything that you require. She's fully bilingual. She was just a little bit shy to speak English on the video, but she's even a psychologist, so she's very professional. On her left, we have Dr. Fernanda Serna, and she's the anesthesiologist that works hand to hand with Dr. Nain. They are married, so they know how to work in team very well, and that's even, you know, it makes it less stressful to be on the surgery, because a lot of times patients can get stressed in this moment that they arrive to the hospital, in the moment that they get to use the clothes that are required there. And we are always very happy to do what we are doing, and also want you to be comfortable with that and to know that this is something that we are used to do a lot. And on the right of Dr. Nain, you can see Claudia Amelia. She's the nurse that is specialized in surgeries. So she's always conducting the other nurses that normally is the staff of the hospital. So she's our personal tool provider for the coordination of what is required during the surgery. She worked also in Mexico City with a neurosurgeon. So she's also very experienced. And on her right, there's another doctor that takes care of you or can be even at the operating room. This picture was taken in May, and currently we are working with another fellow that wasn't able to be on the picture, that he has already finished the degree as a plastic surgeon, and he's starting to be trained with us. So he's also very close to Claudia, helping the doctor. He's always checking on the post-surgery, whatever indication the doctor say, and that also helps us to do something that other doctors don't. We are constantly checking on you. We check on you once the surgery is done, in the night, in the very morning, the moment you leave the hospital. So you have like a lot of contact with our doctors, and even if you have any need, there's a lot of people that is gonna listen to any consideration that you have. Some patients may be worried about pain, but after the surgery they are surprised because there's no pain, and yet we tell them anything, just let us know. That's what that's what we are here for. So that's our services. We are happy to share this, and in the future, in case you need, give me 1 second. Sorry, because the computer is running out of battery. So there we go. And so that's a little brief presentation. And we can move to questions that you have for any procedure, about the doctors, about where to stay, about transportation, even the laboratories. We take them up to the place that you are. So we are open to start a little conversation with you.
Thank you, Luis. That was wonderful information. I would like to know a little bit more about your package, the one that includes transportation and everything. How does that work? I mean, what does that include exactly?
Okay. For instance, if we are looking at a procedure that is gonna be a breast augmentation, we are around the $4,500, and we have to check the exact exchange rate of the day, but let's say that it's 4,500. So some other doctors are charging a little bit less, and that makes it a little more attractive. But considering this package, we include everything. You just worry for the plane tickets, and you would have a stay here in Cancun of 10 to 13 days for another $1,000. So that would make $5,500 for all inclusive package.
That is great. Does that include also the garments that you use for some surgeries, like breast surgery or tummy tuck?
Yes, they are all included. And furthermore, we include 2 of them because after the surgery, the body is starting to scar, and there is still a little bit of blood, and it gets a little bit red. And so the next day we change it, so you can leave the hospital very, very clean of all of it.
Sounds great. Guys, do you have any other questions?
Something about medications, yes, they are all included. We have them as a package. The normal standards of procedure includes the same medication for that procedure. So it is considered unless you have a special requirement or a medical exception. Those are not included, but those would hardly ever happen. And furthermore, we include a COVID test upon arrival. When you meet the doctor, that's also something very important. The itinerary would be arrival. The next day, you go to the doctor. Someone goes to your home to take the laboratories, and you meet the doctor. We have your results. You have an EKG. You meet our plastic surgeon team, and the next day is the surgery. And the moment you arrive to the hospital, we take a COVID test. And when you go back home, we take another COVID test. Okay.
Hi, Louis. I really enjoyed your presentation. Thank you so much. I think it's important to show a lot of the facilities and also a lot of what you've gone through. I just have one question. What type of anesthesia do you use, or what do the surgeons use for their anesthesia? Because I know that it varies significantly depending on different regions, whether it's IV drip or whether it's general anesthesia or sedation. Can you tell us what type of anesthesia is used in these procedures?
I can tell you partially about it because normally the medical information, I don't have it because it is a part of the consultation, but the doctors use any type that it's required. There are a lot of them, and we have had some cases of patients from the United States concerned about narcotics because in Mexico they are very regulated. Dr. Fernanda Serna, she has some specialties in pain management. So she's one of the very few anesthesiologists in the state of Quintana Roo authorized to the use of narcotics, because also outside of the Riviera Institute, she has a pain clinic of her own. So now when it comes to a particular case, I wouldn't be able to tell you, but they have it covered.
Yeah, that's okay, Luis. And I'm glad that you mentioned that about pain management, because not everybody does handle general anesthesia well. And in some cases, that is only what is available. So it's good to know that there are these other options as well, to see, what's going to work best for the patient. So yeah, so thank you. That was my only question. Well done. That was good to know, good to learn. Thank you.
Thank you. You're very welcome. I see another question from Ginny that says, if multi-surgeries and a longer recovery, what is the maximum stay that can be arranged? And is there a multiple surgery discount? So the first question is, as long as you want, there is no maximum. Some patients have come here that they want literally everything done. They want their thighs, they want their arms, they want the lipo, they want the tummy tuck, they want the facelift. They have like a multiple set. So we separate the package in 2 operating sessions. The first one, and after 3 weeks or more, depending on each case, then we have the second one. So we have had patients that stay here up to a couple of months sometimes. And of course, there is a discount because this efficiency of only using 1 night at the hospital and 1 set of anesthesia makes us able to give you a better price. That I want to put some personal experience about it with the anesthesia is that my family background are doctors. I am a marketeer, but my father was a doctor, and somehow I've been seeing a lot of medical circumstances. Some of them have made me feel like a little bit nervous about it, because I've also seen people coming out from anesthesia having trouble with breathing or being very stressed or something. And the few surgeries that I've been recording for marketing purposes or taking pictures as the ones that you saw, the patients have a very, very smooth coming back from the anesthesia. They are very relaxed, and sometimes even Dr. Maria Fernanda asked me to record this. And I didn't know why, but now I know, because that's like a major achievement to see just a couple of eyes opening and a little bit of confusion, but nothing else, you know. That's very, very good to know about that.
I think this is a wrap up, Luis. They don't have any more questions, and I'm sure that if they have some more, I will let me know and I will let you know. Okay, so Jeannie's asking something else.
Jeannie, yeah, the price list. That's something that we can discuss in person with Patricia for each package, because as a matter of fact, it depends of what's the package gonna be. We wouldn't have a price list. Even from there, we start to personalize the service. So Patricia and I are very constantly in contact, and she sends us your file, and then I show the file to the doctors, and they tell me a possible surgical plan. I quote that, and after the surgery, we confirm that surgical plan. For you guys that were with us today, of course, and the special is that we will include for free a Botox upon your procedure. So if you're interested to explore further, get in touch with Patricia, and we will schedule the consultation. And once you are here, all of the people that were with us today will have this promotion of Botox for you. The Botox would be the regular application. It is close to, well, the regular application of it. I don't have the number. I have to check it on the computer, but I will let you know.
Sounds great. Thank you so much, Luis. It was really a pleasure to have you with us. I really appreciate it.
Thank you too. And if there's nothing else, so it was a pleasure to speak with you. We are always here to help you, and any more information that you require, because sometimes I understand that going to a foreign country, particularly to a country that it's on the development, might seem to be an experience that can be with a less quality. But I always am checking on hospitals on the United States, not only to be at the same level, but to go beyond, you know, to give you always the best quality that you can have. And the advantage is that pesos versus dollars, always pesos are gonna be cheaper. That's the difference.
You're absolutely right. Sounds great. Thank you so much, Luis.
You're welcome. Have a good afternoon.
You too. Bye-bye.
Bye.